Do you really need Viagra? What every man should know. If you've ever struggled to get or maintain an erection, you're certainly not alone. In fact, erectile dysfunction affects millions of men worldwide. And when most men think about treating it, one name immediately comes to mind: Viagra. But here's the question. Do you actually need Viagra? Or is there a better solution? In this video, we'll explain how Viagra works, who should take it, who shouldn't, and why erectile dysfunction is sometimes much more than just a bedroom problem. What is Viagra? Viagra is the brand name for a medication called Sildenafil. It belongs to a group of medications known as PDE5 inhibitors. These medications help increase blood flow to the penis, making it easier to achieve and maintain an erection. But here's something many people don't realize. Viagra doesn't automatically give you an erection. Sexual stimulation is still required. Without arousal, Viagra usually won't do much. That's one of the biggest misconceptions about the drug. Do you actually need Viagra? Not necessarily. Occasionally, having difficulty getting an erection is completely normal. Stress, poor sleep, alcohol, relationship problems, even anxiety before sex. All of these can temporarily affect erections. If it only happens once in a while, medication is often unnecessary. However, if the problem persists for several weeks or months, it's worth talking to a healthcare professional. What causes erectile dysfunction? Many people assume erectile dysfunction is simply part of getting older. That's not true. Age increases the risk, but erectile dysfunction almost always has an underlying cause. Common causes include diabetes, high blood pressure, high cholesterol, smoking, obesity, low testosterone, stress, anxiety, depression, certain medications. In many men, erectile dysfunction is actually the first warning sign of cardiovascular disease. The blood vessels supplying the penis are much smaller than those supplying the heart. That means circulation problems often appear there first. Sometimes erectile dysfunction develops years before someone experiences a heart attack. That's one reason doctors take it seriously. How effective is Viagra? The good news is that Viagra works very well for many men. Clinical studies show that it improves erections in about 70 to 80% of men with erectile dysfunction. However, it's not equally effective for everyone. Men with severe diabetes, advanced nerve damage, or after prostate cancer surgery may respond less well. If Viagra doesn't work the first time, don't panic. Some men need to try it several times under the right conditions before deciding whether it's effective. How should Viagra be taken? For the best results, take it about 30 to 60 minutes before sexual activity. Avoid heavy meals beforehand, especially fatty foods. Limit alcohol, since excessive drinking can reduce its effectiveness. Remember, sexual stimulation is still necessary. Many men make the mistake of taking Viagra after a large dinner and expecting immediate results. That can reduce how well it works. Common side effects. Like every medication, Viagra can cause side effects. The most common include headache, facial flushing, nasal congestion, indigestion, mild dizziness, temporary changes in vision, such as a blue tint. Fortunately, these side effects are usually mild and temporary. Who should not take Viagra? Viagra is very safe for most healthy men. However, there are important exceptions. You should never take Viagra if you use nitrate medications for chest pain. Combining these medications can cause a dangerous drop in blood pressure. You should also speak with your doctor if you have severe heart disease, very low blood pressure, certain rare eye diseases, significant liver disease. Never buy Viagra from unregulated websites. Counterfeit medications are surprisingly common and may contain dangerous ingredients. Always obtain it through a licensed pharmacy. Is Viagra addictive? No, Viagra does not cause physical addiction. However, some men develop psychological dependence. They begin believing they can't perform without it, even when they physically could. That's why it's important to address the underlying cause of erectile dysfunction whenever possible. Can lifestyle changes help? Absolutely. In fact, lifestyle changes may improve erections just as much as medication in some men. The most effective changes include regular exercise, losing excess weight, stopping smoking, limiting alcohol, controlling diabetes and blood pressure, getting enough sleep, reducing stress. Healthy blood vessels mean healthier erections. What about Cialis? Many people ask whether Viagra or Cialis is better. The answer depends on the individual. Viagra typically lasts around 4 to 6 hours. Cialis can remain effective for up to 36 hours. Some men prefer the longer flexibility of Cialis. Others prefer Viagra because they've used it successfully for years. Both medications are effective and should be discussed with your doctor. When should you see a urologist? You should consider seeing a urologist if erectile dysfunction lasts longer than 3 months. It becomes more frequent. You have diabetes or heart disease. You lose your morning erections. Viagra isn't working. The problem is affecting your relationship or quality of life. Remember, erectile dysfunction is often a symptom, not the disease itself. Finding the cause is just as important as treating the symptom. Final thoughts. Viagra has helped millions of men regain confidence and improve their quality of life. But it's not the answer for every man. Sometimes the best treatment isn't a pill. It's treating diabetes, improving heart health, losing weight, reducing stress, or identifying an underlying medical condition before it becomes more serious. The bottom line is simple. If you're struggling with erections, don't just ask whether you need Viagra. Ask why the problem started in the first place. If you found this video helpful, don't forget to like, subscribe, and turn on notifications for more evidence-based urology and men's health content. And remember, healthy erections often begin with a healthy body.